Welcome back. This is part 21 of things that your vet staff wishes that you knew, and in this video we are going to cover chart alerts. There are so many potential alerts that could be on your chart at the vet. Most of them are dealing with your pet and how they act at the vet. One of the most common things that we are going to chart about your pet is their demeanor, how they acted at the vet. And that doesn't mean just what you tell us. We are going off of experience based in the back. How did they act when we were actually working on them? If they tolerated everything relatively well, their chart might look like friendly, or maybe we'll include an anxious or shy in there. If your pet attempted to bite or scratch at least once, they will probably get a caution on their chart. But it can escalate from there because some of them will only do it if they're painful or extremely scared. Or maybe it's just nail trims that set them off. If they are consistently trying to bite or scratch us, it might look like bites, aggressive, muzzle necessary, and pre-med before appointment. Sometimes we have a specific tag just for cats called kitty minutes, meaning that they will tolerate you for a little while, but you have limited time before they start to get aggressive with you. For dogs, we might also have to chart whether they are dog aggressive or if they're owner protective. And I don't want you to feel embarrassed if your pet is acting a fool back there, because I'm gonna make you feel better. Hold on one sec. This is one of my pet's charts. Pre-med for appointment, caution, bites, muzzle necessary. All red, he is a bad boy at the vet. Let me add to that. I'll make you feel even better. It took 5 technicians to get his blood last time. 5 on a dachshund. You're having a hard time picturing that on such a small dog. Let me paint a picture for you. I had him in air jail. One other technician was holding off the arm to poke. Another one was actually poking. Another one was patting his head, and the last one was patting his butt. I bring up his example frequently in clinic rooms to make owners feel better, because I want you to know even your vet staff is not immune. We will also chart if your pet is allergic to a specific protein like chicken, or if they can only have the hypoallergenic treats. It will also be notated extremely clearly if your pet has ever had a vaccine reaction or a medication reaction in the past. Along the same lines, if your pet has any significant chronic health issues, those are also going to be charted very clearly. All of these alerts are important in one way or another. They keep us safe, they keep your pet safe, and they make sure that we can give them the best care possible. There's not enough time to cover it in this video, but I will mention that in a future video I will cover the fact that there are alerts for you as a client and not about your pet. That's all I have time for, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 22 of things that your vet staff wishes that you knew. In this video, we're going to finish talking about chart alerts, referring to the ones that are about you and not your pet, and then we'll talk about how to get fired from your clinic. There's really only a few things that we might chart about you in particular, and not all of them are bad. One potential chart alert is OAA, and that stands for Owner Appreciates Attention, and it can go one of 2 ways. It can be an OAA positive, or it can be an OAA negative. OAA positive usually means either you were really chatty and really friendly with us, or maybe you're just slightly higher maintenance than a typical client. It's not a bad thing to be marked as this, but it does tell us that appointment could run past our time. An OAA negative means that there is a documented issue with behavior at one of your previous appointments, and we don't put that in there lightly. It is reserved for things like yelling at the staff, being verbally aggressive, ignoring safety protocols, or just repeatedly creating conflict. Being marked as an OAA negative is usually the first step before restrictions are placed on your account. If you progress past the OAA negative, you're going to start seeing managerial strikes on your chart. My clinic personally uses the whole 3 strikes you're out rule, but sometimes if you are especially egregious, it's one and done. Now let's talk about the things that could get you fired. The first one is yelling at, being disrespectful, being verbally aggressive, or inappropriate towards our staff. We will not tolerate it. Another way you could potentially get fired is repeatedly no-showing your appointments or refusing to pay. Another way you could potentially get fired is repeatedly demanding care that would violate medical standards. By that, I mean maybe you're demanding a medication without an exam and we haven't seen you in a year. Or maybe you are wanting us for some reason to continue after we've told you, hey, this isn't getting done today. They are really scared, they're biting us, and you pull something like, well, can't you just hold them down? If we have come back to say that we can't get something done today, it is a safety concern. We are coming back because either we are going to get hurt or your pet is going to get hurt, and it is not worth it. We don't put any of these alerts on your chart as a punishment. It is to help us. It is a valid thing that we need to know before we go into an appointment. Is this client going to be aggressive with us potentially? Or are they going to talk and be super duper friendly and we need to be prepared for that appointment to run longer? Like these are important things we need to think about. One more last point I'll make before I wrap this up is if you have been fired and your next clinic calls us for records or just to ask, we're going to be honest. We are going to tell them that you were fired and why. That's all I'm covering for this video, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 23 of things that your vet staff wishes that you knew. And as promised back in part 8, I believe, we are coming back to talk about cat vaccines. And the first one I'm going to discuss is the FVRCP vaccine. It's a combination vaccine, meaning that there are 3 different vaccines in that one poke. The FVR part of it stands for feline viral rhinotracheitis. The C stands for calcivirus, and the P stands for panleukopenia. Feline viral rhinotracheitis is essentially a very contagious herpes virus that primarily causes upper respiratory disease in cats. It is very common, and most cats that are exposed become lifelong carriers of it, meaning the virus never fully leaves their system. Because of that, once they have had contact with it and they are now a lifelong carrier, it can flare up in times of stress. So say that they didn't like their new litter, or maybe you got a new cat, or maybe you moved houses. Congratulations, we got another upper respiratory infection. It is spread through things like respiratory droplets, eye discharge, nasal discharge, contaminated objects, or just close contact. Typical signs could include sneezing, nasal or eye discharge, conjunctivitis, fever, decreased appetite, or lethargy, but severe cases could turn into corneal ulcers, keratinitis, and chronic eye disease. Calcivirus is another upper respiratory virus that often causes oral disease. It is spread through things like saliva, nasal discharge, and contaminated surfaces. Typical signs might look like sneezing, nasal discharge, fever, oral ulcers being a very telltale sign of this, drooling, difficulty eating, and lethargy. But severe cases could turn into extreme fever, facial swelling, organ failure, or even death. Panleukopenia is feline parvovirus, and it is very dangerous. It attacks rapidly dividing cells such as those found in the intestinal lining, bone marrow, and lymphoid tissues. It causes a dramatic drop in white blood cells and destroys the immune system. It is spread through feces, contaminated objects such as litter boxes and cages, or even our clothing and shoes. And it is very hardy. It can survive in an environment for months to a year. Signs would look like vomiting, extreme diarrhea, dehydration, fever, lethargy, and even sudden death. And it is especially serious in kittens. I do want to quickly mention that if a pregnant cat was to get infected with this, the kittens are now highly likely to develop cerebellar hypoplasia, or the wobbly cats you probably have seen videos of. Let's quickly talk about the vaccine itself. The very first several times your cat gets it, they will be vaccinated up until 16 weeks of age. At 16 weeks, they can get their 1 year. After 1 year, it'll be a 3-year vaccine. That's all I'm covering for this video, so let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye. Welcome back. This is part 24 of things that your vet staff wishes that you knew. We are continuing to finish up cat vaccines right now, and this video will cover FELV. FELV stands for feline leukemia virus, and hearing leukemia, you might associate it with the same way you would see it in humans, but it's not the exact same. It is a virus that can cause leukemia and lymphoma, but it is not the cancer itself, it's a virus. FELV is a retrovirus, retro meaning backwards because it goes against the typical biological pathways of DNA to RNA to protein, and instead it will take its RNA, turn it into DNA, and input it into the host cell's genome. Once it does this, that viral DNA becomes a part of the cell, essentially making it a virus factory. So why did I just give you a whole microbiology lecture? Because it's usually lifelong. Once they've been infected, that virus is usually there to stay. I do feel like it's important to mention here that not every cat that comes in contact with it ends up permanently infected with it. Some of them are able to clear it. Some of them have it kind of hide out in their bone marrow, and it's pretty rare that they become like a legit carrier of it. And then some of them get the full-fledged, all of it. FELV, much like the traditional leukemia you would see in humans, causes immune suppression, leaving them more susceptible to any pathogens they might encounter. It is also known to cause bone marrow suppression, leading to anemia and low counts of white blood cells and platelets. And again, I do want to reiterate, FELV can cause cancer. Leukemia and lymphoma can be caused by having FELV. It is spread through bodily fluids, with saliva being the number one perpetrator. It can also be spread through nasal secretions, mutual grooming, shared bowls and food, bite wounds, and also from mother to kitten. Some potential signs you might see are weight loss, lethargy, poor appetite, intermittent fevers, enlarged lymph nodes, pale gums, generally just very sickly, chronic mouth inflammation, and recurrent upper respiratory infections. So now let's talk about the vaccine itself. This is a lifestyle vaccine, meaning we don't necessarily recommend it to everybody, but we do frequently recommend it if your cat goes outside. A special case would be if you have multiple cats in the household and one of them is positive for this, you would want to vaccinate to keep your other kiddo safe. The very first time you get it, you will need a 3 or 4 week booster, but after that, it is a 1-year vaccine. That's all I'm covering in this video, but let me know if you have any questions or suggestions. Drop them down below. Love you guys, bye. Welcome back. This is part 25 of things that your vet staff wishes that you knew. And in this video, we're going to talk about vaccine reactions. I do want to preface that these are rare. We really don't see them very often. And the chance that it could happen is not a valid reason to choose not to vaccinate. Because if you go back and you look at any of the videos that I've posted about the diseases that we vaccinate against, they are far more dangerous than taking a chance on a vaccine reaction. If you are really concerned about it, you can always split the vaccines up. You do not have to get them all at once, although it does mean more trips to the vet. First, let's talk about the things that are not a concern and almost expected after your pet gets a vaccine. Just like if we got a vaccine, if your pet is a little tired or a little sore at the vaccine site, that is not a concern unless it doesn't go away within a few days. Another common thing you may see after a vaccination is a small bump at the injection site. And these can take a good bit longer than some of the other side effects to go away. For dogs, it can take anywhere from days to a month to finally dissipate, but as long as it is not growing, doesn't seem to be bothering them, or just never goes away, it's not a concern. For cats, that bump can hang around a good bit longer, and a lot of clinics will use a 3-2-1 rule to decide if it's a concern. So if it has been 3 months since the vaccination and the bump is still there, and it is larger than 2 centimeters and was still growing 1 month after the injection site, it is concerning enough to take a biopsy. This is especially true in cats because they do have the potential for a rare complication called vaccine-associated sarcomas. I don't want you to hear that and automatically assume that vaccines cause cancer, because that is not the case. This is a rare exception and a risk that we are very aware of and constantly assessing if your pet has presented with a lump. I do want to reiterate, if that scares you, those diseases that we are vaccinating against are still far more dangerous and more likely to happen than this rare complication. Now let's talk about the things that are concerning. Most vaccine reactions will happen within minutes to hours of the vaccine. I will mention there is a very rare case where occasionally it's delayed and will take 1 to 2 days to show up, but you will usually see it pretty quickly if they're going to have a reaction. If your pet gets a vaccine and now their face is swelling up, they have hives, they are profusely vomiting, or they are extremely itchy, they are probably experiencing a reaction to the vaccine. So what do you do if this happens? The first thing you're going to do is start loading up your pet to go somewhere, because you do need to see somebody about this, and call your vet. Your vet may advise you to come to them for monitoring, or they might tell you to go to urgent care, but regardless, your pet needs to be seen. That's all I have time for in this video, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 26 of things that your vet staff wishes that you knew, and in this video, we're going to talk about fleas. If you've ever had a flea infestation in your home, you know firsthand just how difficult it can be to get rid of all of them. That is partially because the ones that actually bite you or your pet are adults. The rest are in different life stages. And adults make up only 5% of an entire infestation. The remaining 95% of that infestation is going to be made up of larvae, pupae, and eggs. To put this in perspective, a single female flea can lay between 20 to 50 eggs in a day. So the majority of the infestation is not going to be on you or your pet, it's going to be in your home, in the carpet, on the furniture, in the bedding, in the cracks on your floors. And it's not just the fleas you have to worry about, you also have to be concerned about what they can cause when they bite your pet. The first issue I will talk about is flea allergy dermatitis. Basically, your pet has an allergy to the saliva of the fleas. Pets that are allergic to the saliva are going to get extremely itchy when this happens. To a point, some of them kind of tear up their own skin in the process, so it may look like hair loss, redness, and even the occasional self-inflicted wound. When it gets that severe, you also have to worry about infection because they are creating open wounds on their body. This will most commonly happen on their lower back, base of the tail, and thighs. I want to mention for cats specifically, when this happens, you may not ever actually see evidence in their fur of fleas because they are so good at grooming themselves. You may only see the hair loss, the redness, and the wounds. Another issue I want you to know about is tapeworms. Fleas can give your pet tapeworms. I will clarify that this infection with tapeworms only happens whenever your pet eats a flea, not from the bite itself. So if your dog is really itchy and starts chewing at their hind end and eats a flea, that can give them tapeworm. Or if your cat is grooming and eats a flea, that can give them tapeworm. Now let's briefly talk about how flea and tick prevention can prevent this. Being on flea and tick prevention does not mean that a flea or tick cannot land on your pet and bite them. But it does mean if they bite, they are going to die. By killing them off after they bite, they no longer have the chance to continue to reproduce and create an infestation in your home. They are stopped dead in their tracks right there. That's all I'm going to cover in this one, so let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye. Welcome back. This is part 27 of things that your vet staff wishes that you knew, and this time we're going to talk about ticks. The good news about ticks is you are not as likely to end up with an infestation in your home as you would fleas. The bad news is they carry a lot of diseases. Unlike fleas, ticks don't just bite. They anchor themselves and they hang out for a while. When they bite, they have these backwards facing barbs in their mouth that anchor them to the skin. Then, on top of that, they produce tick cement to hold them in place. Most diseases that ticks can transmit require them to be attached to the host for 24 to 48 hours, and that is why early removal is important. For the purpose of this video, there are 4 diseases I'm going to mention that come from ticks. The first one I want to mention is Lyme disease, and I'm not going to go into detail in this video because I did already cover it when I talked about the Lyme vaccine, so if you're interested, you can go watch that video. I believe it was part 5. The second disease I want you to know about is Ehrlichia. Ehrlichia can be a little tricky to diagnose sometimes because it progresses through stages, the first one being the acute stage, the second one being the subclinical phase, and the last one being the chronic phase. Because I'm limited on time, I'm going to keep this brief, but I do want you to know that 1, the subclinical phase can last anywhere from months to years, and the dog may show no signs during this time period. And the second thing I want you to know is that it can become chronic and very serious. The third disease I want you to be aware of is anaplasmosis. There are 2 primary anaplasma species that infect dogs. One of them attacks the neutrophils and the other one attacks platelets. Symptoms could look like fever, lethargy, decreased appetite, shifting leg lameness, and stiffness in the joints. All 3 of those, Lyme, Ehrlichia, and anaplasmosis, are all tested for on your 4DX heartworm test that you have to get yearly in order to get prevention. But a positive on that test does not necessarily mean active infection. It just means there are antibodies present and your dog has been exposed at some point. So depending on the symptoms and maybe some further lab work, your doctor may not treat at all for these. All 3 of them can also have a pretty good prognosis as long as it's caught and treated early. The fourth disease I'm going to mention is specific to cats. It's called cytozoonosis. Cats that get infected with this can deteriorate extremely quickly and need aggressive care. Very quickly, let's talk about how flea and tick prevention can stop all of these from happening. Flea and tick prevention does not stop fleas and ticks from landing on and biting your pet, but it does mean they will die once they bite, meaning that they do not have the chance to continue to spread infection to your pet. Because I was limited on time, I did not get to go into very much detail about these diseases, so if that's something you want in the future, just let me know. That's all for this video. Let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye. Welcome back. This is part 28 of things that your vet staff wishes that you knew, and in this video we're going to talk about heartworms. Dirofilaria and mitis, or heartworms, are transmitted through mosquitoes. Their life cycle alternates between two hosts, dogs and mosquitoes. While they're in the mosquito, they are still in their larva form, going into the infectious stage before the mosquito bites your dog. While they're in the dog, they are maturing and reproducing. Female heartworms release live larvae into the bloodstream called microfilaria. The microfilaria circulates the bloodstream waiting to be picked up by another mosquito, but the adults hang out in the heart and the pulmonary arteries. It typically will take around 6 months from the time of infection for them to progress into adult heartworms, and that's why we test yearly for these. Early signs could look like coughing, fatigue, and exercise intolerance. Later signs may look like weight loss, difficulty breathing, heart failure. But I also want to mention that there's an extreme case called Caval syndrome where the worms essentially block up the valves in the heart. Usually by the time we see symptoms, the disease is already pretty advanced and it is going to be difficult to treat. Treatment is often long, expensive, and risky, and often involves things like months of strict activity restriction. Now this part is important. Heartworm prevention does not work the same way that flea and tick prevention does. Heartworm prevention does not stop mosquitoes from landing on and biting your pet. It also does not stop them getting infected with microfilaria. What it does do is kill them in their early larval stages before they can become adults and land in the heart. Now let's talk about the heartworm test. So I have talked about the 4DX heartworm test in the past in a few of my other videos, talking about how Anaplasma, Lyme, and Ehrlichia, if you get a positive for them, is not necessarily mean active infection. That is not true for heartworms whenever we test for them, because we are testing for a female antigen. So what that means is we are testing for adult females. And if we get a positive on there, it is almost certain, other than a few rare cases, that your pet is infected with heartworms. That also means there is the very tiny potential for a false negative if for some reason all of the adult heartworms are male, or if you are still in the early stages of infection. I do want to mention that technically cats can get heartworms too, but they are not the preferred host. And it's important to know that if it does happen, there are no safe approved treatments for heartworms in cats. That's all I have time for in this video, so let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye! Welcome back. This is part 29 of things that your vet staff wishes that you knew, and in this video we're going to talk about arthritis. I think it's important for pet owners to know that arthritis is very common and can be almost silent. It's very easy to miss the signs that your pet is in pain. In simple terms, arthritis is when the cartilage in joint spaces wears down and thins out to a point that it's basically bone on bone. It will cause a lot of pain, joint inflammation, and stiffness. A lot of owners will miss it because the signs may just look like aging to them. And by that, I mean maybe they're slowing down on walks, maybe they are slipping on your hardwood floors, maybe they're a little stiff when they first get up, or maybe they are avoiding and struggling with stairs and jumping. Arthritis is degenerative, meaning it will not get better, it will only get worse with time. Once your pet has it, all we can do is manage the pain and the symptoms. There are 4 main risk factors that I will mention for this video. The first one is just being a large breed dog. They have more weight and more stress on those joints. The second one is just being overweight. Again, like the large breed dogs, there's more weight and more stress on those joints. The third would be if they've had any significant injuries or surgeries in the past. Just like humans, if you were to have a knee surgery, it's fairly likely you're going to get arthritis there. And the last one is going to seem obvious, but age. The older your pet gets, the more likely arthritis becomes. In dogs, arthritis could appear as early as 3 to 5 years old if they have enough risk factors stacked against them. Cats can take a little longer to show it, and part of that is just because they're very good at hiding pain. So you might start seeing it around 7 to 10 years of age for cats. I do want to mention that sometimes the pain gets so bad that your pet will start avoiding using the limb that is painful to a point that their muscles atrophy or become smaller. Keeping your pet at a healthy weight and active and starting joint supplements pretty early can help maybe prevent, but at the very least delay arthritis. Once your pet has it, treatment is going to consist of pain management, and that could be something oral like Rimadyl or gabapentin, or it can be injectable. For cats, it's Silencia, and for dogs, it's Librela. One last point before I wrap this up. Just remember, your pets do not show pain the same way that we do. They are generally very stoic, so we have to look for other signs that they may be experiencing it. That's it for this video, so let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye. Welcome back. This is part 30 of things that your vet staff wishes that you knew, and this video is going to cover the one disease that I have a personal vendetta against. We're going to talk about IVDD, or intervertebral disc disease. I feel legally obligated to talk about this one because my family and I have had to watch this up close and personal and see just how much of a thief it is. We've owned dachshunds for a very long time, 40 plus years at least, and around this time last year, it's been almost a year, our youngest dachshund, Mickey, had to have surgery for this. I'm going to show you a picture of him post-surgery here in just a second, and it can be hard to look at, so if you don't want to see that, skip over this part. This is him shortly after surgery. You can see just how long that scar on his back was, and the fact that we had to use that pink sling around his back legs to hold them up for him for a while. Now let's talk about the disease. IVDD is when the discs in between the vertebra in their back rupture or deteriorate, putting pressure on the spinal cord. It has a wide range of severity, from still being able to use their legs to losing all feeling and function of their legs. Some cases can be treated and remedied with crate rest and drugs, but some are as severe as Mickey, where it becomes an emergency surgery that you have to do in 24 hours, or they may never walk again. What's really heartbreaking is there can be cases even worse than Mickey's that are so bad they're not even a candidate for surgery. Dachshunds are not the only breed that are at risk for this. If your dog has a long back, they're at risk. Frenchies, Shih Tzus, Corgis, it's not just dachshunds. If you have a dog that is at risk, there are things you can do to try to prevent it. Number 1, keep them lean. Being overweight puts them more at risk. Number 2, and I harp on this one a lot, have ramps anywhere where they might want to get to an elevated surface, like a couch or a bed. 3, to the best of your ability, limit jumping and rough play with much larger dogs. 4, make sure you are supporting their back whenever you pick them up. 5, keep them active because strong core muscles support the spine. And one more bonus mention, use a harness instead of a neck collar. It puts less strain on the back and spine. Early signs can look like avoiding stairs and jumping, a hunched back, excessive panting, pacing, just general discomfort. And if you start to see any of that, you need to go see your vet, because you do not want it to progress to the point that they can't walk. That's all for this video, so let me know if you have any questions or suggestions. Love you guys, bye.